non-inflammatory and inflammatory acne lesions. These are the non-inflammatory lesions. Open comedones and closed comedones. Comedones, blackheads, and open comedones are called blackheads, and closed comedones are called whiteheads. Now, why they are called blackheads and why they are called whiteheads? Because open comedones are basically those pilosebaceous units who still have their pores open. I told you in the previous slide that there is a pilosebaceous unit. We have got sebaceous gland and then hair follicle. They both are connected by a single duct. That duct opens into the environment with the help of a pore. Now, if that pore is open and then the blocked duct is actually exposed to the air, that will cause the oxidation of the sebum, and that will produce that will turn it into the black color. So this is the reason we have got blackheads, because they appear black. Why? Because the air oxidizes that excess sebum and blocked whatever the formation has become now. After that, closed comedones are basically called whiteheads. Why they are called whiteheads? Because that pore is closed. It is covered by a thin layer of skin, so it is not in direct contact with the air. Because of that, it cannot be oxidized. So no oxidation, that means no blackening. So we have got whiteheads. So these two are the non-inflammatory lesions. These are the lesions which will appear before the inflammation has begun. Inflammation will begin after the bacteria has colonizes those pilosebaceous units which have dilated. Okay, before the colonization of bacteria, we have got these open comedones and closed comedones. These are basically pilosebaceous unit which have excess sebum and dead keratinocytes. That is follicular hyperkeratinization. So we can say that we have got follicular dilatation as well as we have got sebaceous gland hypersecretion. That is comedone. Okay, now two types. There are two types: open comedone, closed comedones. Open are exposed to the air, so they will turn black, and closed are covered by the skin, so they are white. And finally, we have got inflammatory lesions. Inflammatory lesions are papules, pustules, nodules, and cysts. We talked about their details and definition in our previous lecture. You can see it in my playlist. So here I will only be discussing them briefly. Inflammatory lesions, because they will begin once the inflammation has set off. Because once bacteria has colonized that pilosebaceous unit, then it will start secreting inflammatory mediators. Those mediators will in turn set off this inflammatory process. And then we have got papules, pustules, nodules, and cysts. Now let's talk about the severity of acne. Severity of acne, it depends. We have got mild acne, moderate acne, severe acne. Mild acne are basically comedones and few papules. If we have got comedones and few papules, there is no pustules, then we have got mild acne. If we have got papules and pustules, then that is moderate acne. But if we have got nodules, cysts, and scarring, that is severe form of acne. There is another form of acne that we call that acneiform eruption. What is that? That is basically when acne develops on the face, on the trunk, on the back, shoulders. When it falls on the upper trunk and face, that is called acneiform eruption. It could happen because of certain triggers, that suddenly once something is triggered, maybe it could be infection, it could be anything, or steroid use even. It is more common in males. In males, we have got this acneiform eruption where the whole face, upper trunk, back, and shoulders are involved, but the lower limbs will be spared. Okay, so that is, we have got mild, moderate, and severe form. Sometimes we see mild to moderate, then sometimes we see moderate to severe, and sometimes we have got even severe acne in some females. And even in males, we see acneiform eruption. Okay, that is basically the eruption of acne on the face and the upper trunk. Now that is the distribution of acne. It involves face, neck, trunk, shoulders, and back, as I already mentioned. Okay, that is the distribution. It won't involve lower limbs. You must remember this. Now we have got types of acne. Acne present as different variants. It has different variants. So we will be discussing them briefly in our next slides. Here are the different types of acne. Acne vulgaris, the type of acne which we have been discussing till now. Okay, that was acne vulgaris. It is the most common form of acne. Comedonal acne. Then we have got inflammatory acne, nodulocystic acne, acne conglobate, acne fulminans, acne mechanica, drug-induced acne, and acne inversa. We will be discussing them briefly in our next slides. Acne vulgaris. What is acne vulgaris? I already mentioned it is the most common type. It occurs in adolescents and young adults. Why? Because in that age we have got puberty, and puberty causes excess androgen secretion, and that excess androgen will cause hypersecretion of sebaceous glands, and though that hypersecretion will then set on that whole inflammatory process, and then acne will happen. Characterized by comedones, papules, and pustules. These are the characteristic lesions of acne. It will involve face, chest, and back. Okay, that is acne vulgaris. You will see. Next is comedonal acne. Comedonal acne. In comedonal acne, we have got comedones. Sometimes patients come to us with only comedones. They have only blackheads or whiteheads, or sometimes both, but they don't have any pustule, papules, or nodules, or cysts. So that is the comedonal acne. And here the comedones predominates. They are the most common occurring lesion in this type of acne. Open comedones, blackheads, and closed comedone, little inflammation. You won't see any significant inflammation. It will be, even if there is inflammation, it will be only a little amount. And then we have got very low chance of scarring. Here the chance of scarring is very low because these are not that deep lesions. These are superficial lesions, so here the chances of scarring will be low. Next up is inflammatory acne. Here the inflammation will ensue, and we will get papules and pustules. Erythema will be present. Erythema is the redness of the skin that will be present in inflammatory, since inflammation is associated with redness, and then pain, and we have got heat at that place, painful lesions, and then some risk of scarring. In this type of acne, we have got some risk of scarring. Then those lesions are painful because of the inflammation. This is quite a severe form of acne, that is nodulocystic acne. Here we will get deep nodules, cyst formation. These are very painful lesions, very high risk of scarring. Very high risk of scarring. That is important because in this is the severe form of acne, and scarring is quite having high risk. Next up is acne conglobata. Conglobata, it is a severe form of acne, but it has interconnected nodules. In this formation we have got abscesses. Abscesses will form sometimes, and scarring is very common. It's like it's even more severe than the nodulocystic. Okay, so next up is acne fulminans. Acne fulminans is the more severe form even than the nodulocystic acne. It is the sudden onset severe acne, sudden in onset and severe in nature. Fulminant, you must have heard this word before, like fulminant hepatitis. Okay, the fulminant is often used where we have to describe the sudden onset severe form of a disease. That's where we use this fulminant word. So acne fulminans is the sudden and severe form of acne. Fever and other systemic symptoms are also present. Ulcerative lesions, we get ulcerative lesions in this acne fulminans seen in adolescent males. Next we have got acne mechanica. Acne mechanica occurs due to the friction or pressure, as the name indicates. Mechanica, that is something related to the mechanism, or maybe friction and or pressure. So here we will get acne due to some friction or pressure, like helmets, masks, tight clothing. They can produce acne because of the irritation, and that irritation will trigger the acne. It can result into inflammation. Sweat and occlusion. helmet. In helmet, sometimes we have got excessive sweating, and then that excess sweat and then further occlusion will trigger this acne, seen in athletes. More seen athletes. Athletes are often having too much sweat. So yeah, this acne mechanica is mostly seen in athletes. Next, we have got drug-induced acne. It occurs due to the steroids, lithium, phenytoin, isoniazid, oral contraceptives. These are the common drugs that cause acne, and these are monomorphic lesions. Okay, let me explain this thing. In acne, we have got acne is a polymorphic disease. Why? Because in this acne we get polymorphic lesions of different forms like papules, pustules, nodules, cysts. In a single disease, we have got different forms of lesions. So acne, when we talk about acne vulgaris, we have got it is a polymorphic lesion. So but here this is drug induced. In drug induced acne we will get monomorphic lesions. Monomorphic means of one kind, of one shape. All the lesions will be of same type. Okay, no comedones will be present, no comedones. Acne inversa is called hydradenitis suppurativa. It affects apocrine glands. Okay, this is quite a different thing. Like in acne, as we mentioned and we talked about the pathogenesis of acne, the glands involved were sebaceous glands, but it is acne inversa. That is, it is the inverse of the normal form of acne. In normal form of acne, sebaceous glands are involved, but here apocrine glands are involved. And they act the whole process is the same as that of acne vulgaris, but here just the glands are different. Like here we get apocrine glands, and those get affected in this form of acne. And where they are present, these apocrine glands are present usually in axilla, groin, inframammary lesions. So in these areas, if you see acne in these areas, then that is acne inversa, hydradenitis suppurativa, and it could be quite painful because friction and rubbing of these areas, then it can worsen the acne. Nodules and sinus tracts can form in this form of acne. And okay, so this is the last form of the acne. This is called secondary acne. What is secondary acne? Secondary acne is the type of acne which occurs due to some other disease. That is, the main cause is something else, and then because of that cause we have got acne. So what could it be? It is hyperandrogenism. Hyperandrogenism means that is excess secretion of androgens. It could be due to tumor, it could be due to any condition. And we have got virilization. In hyperandrogenism we have got signs of androgen excess. What are those signs? Those signs are basically hirsutism. Hirsutism is the distribution of hair on the face, mainly on the chin, on the beard area in females. This is in females. We are talking about females. In females we have got signs of androgen excess, that is hirsutism. Secondly, we have got menstrual instabilities, menstrual irregularities that will occur in case of excess androgen. We have got PCOS. PCOS could also be the cause of acne. In acne, we have because those PCOS lead to hyperandrogenism, and that excess androgen will produce acne lesions. Now we have got factors that aggravate acne. What are those factors? Those are hormonal changes. As I already mentioned, hormones play a very important role in the pathogenesis of acne. So hormonal changes can trigger acne. Stress is another factor. Then we have got cosmetics. Sometimes we see patients who have used some certain types of makeup and certain types of creams, and after that application they have got acne. So that application, why that happens? Because it's because of the cosmetics, because they contain comedogenic agents. So those agents will trigger acne. Next up, sweating. Excessive sweating can lead to acne or even exacerbation progression of acne, and then we have got occlusion, and finally drugs. These are the factors which aggravate acne. Now we have got acne complications, which is quite important because these are the complaints of our patients most of the time. Even after the acne heals and resolves, these are the complications which still concern the patient and makes them somehow in distress. Okay, what are those complications? Scarring. This is quite important because if in severe, as I already mentioned, that in severe or moderate to severe form of acne, we have got scarring, and even if the acne heals, the scarring will still cause psychological issues in the patients, and even social dilemma. Post-inflammatory hyperpigmentation, the scar remain, and the area where the papules or pustules grew there, and then once they fade out, they leave this hyperpigmented area. Okay, then we have got post-inflammatory erythema. Erythema is again the redness after the inflammation has faded. Then we have got redness. It could be the remaining or resolving redness. Then we have got psychological distress. This is the most important point, this point, because social factor plays an important role in this. Most of our concerns are cosmetic concerns. Acne doesn't do that much. Like even if we have got non-painful lesions, still patient come to us with these complaints like whiteheads, blackheads. Why? Because the psychological distress is the main concern of the patient due to the social dilemma, due to the social factors and stigma. We have to confront these cases.